Hi, Dr. Linda Park here. This is the tail end of my work week, and I had several patients in this week that I want to share with you. I'm not giving names or anything, but I just want to talk to you about some of the things that I saw that are very interesting. I had 3 patients on Monday who all had orthodontics when they were young. Now they're all in their midlife currently, and they came to me with chronic headaches. There was one person who has high blood pressure. She's very slim, very fit, but she has high blood pressure. Why is that? Another person with a chronic headache, somebody else who has tried everything, seen neurologists and all kinds of things for his headaches. And they all had orthodontic treatment when they were younger and had 4 bicuspid teeth extracted. Now the bicuspids are the teeth that are directly behind your cuspid teeth or your canine teeth, the pointy ones. The bicuspid teeth often back in the 90s, 80s, probably 70s, were teeth that were removed to try to make straight teeth for people. So when that happened, the 4 bicuspid teeth got extracted, and then they had all this space that they had to close. So what they did is pulled all the teeth back. And when you pull all the teeth back, you crowd the tongue. And when you crowd the tongue, it causes all sorts of problems. So no longer is the God-designed house or room big enough for the tongue that was made to be there. It's been shrunken and moved back. Well, where's the tongue go? The tongue goes back into the throat. And so there are chronic problems with the tongue being back in the throat. One of them is you don't sleep well. You can't eat and swallow as well. You can't hold your neck in the position that it should be all day long. And so everybody, depending on genetic tendency, is going to end up one way or another. So again, it comes back to airway, because when you have a tongue that belongs up here and is now back here, it's going to affect the way you breathe and swallow and the way you sleep at night. So therefore, we're going to see problems like chronic fatigue potentially, headaches, fibromyalgia, high blood pressure, acid reflux, TMJ problems, tooth grinding, and many other things. Could be dry lips, could be bad breath, could be decay that there's no particular reason. Diet's good, sugar's not an issue, but you've got 10 cavities or 2 or 3 cavities and you never used to have any. So I continue to harp on breathing through your nose, but those are some of the reasons why that's important. A couple of other patients that I saw this week were similar issues, but in a different vein. One of them is someone that I've talked to her about mouth breathing for probably 3 or 4 years. And she told me today that she failed every marker for her physical when she just got back from the doctor. So she has pre-diabetes, she has high cholesterol, she has high blood pressure, she's overweight, and she's always had chronic gum inflammation. So we've been dealing with her periodontal disease for years, and she is willing to embrace mouth taping and healthy eating now because she failed everything at the doctor's office. So when you struggle with sleeping with your mouth closed, it has so many other effects on the body that are concerning. And it's important to start focusing on it and to consider that as a primary focus when you're sleeping. Another person that I saw has beet red gums all on her front, around her front teeth. And we need to do crowns. Her mouth is full of decay because it dries out when she sleeps. So, and her gums are very, very red. She needs 4 crowns on her front teeth. And I told her, I said, I really can't do those crowns until we address the cause of the red gums, because I can't make beautiful crowns if I don't have an environment that is able to be controlled. So she told me, I tried the mouth taping, but it was terrifying for me, so I took it off in the middle of the night. So addressing mouth taping, once again, as something that's very important. I myself use it every night because if I don't, my mouth comes open. For somebody who doesn't mouth tape and has anxiety issues or ADHD or depression, all those things can be brought on by sleeping with your mouth open. So when you sleep with your mouth open, again, your brain isn't getting the correct amount of oxygen and carbon dioxide, and it doesn't get to do the work of healing when you're sleeping. And when it doesn't get to do that, your adrenals also release what's called cortisol. And cortisol makes you anxious, can make you depressed, it can make you all sorts of things. So those people that tell me, oh, I could never tape my mouth closed because that's terrifying to me, those are the people that almost need it more than anybody else because it causes so many other issues. So I always recommend to patients to just give it a try. Thank you so much for taking the time to watch these videos. I hope you find them helpful. They're not comprehensive by any stretch of the imagination, but they do kind of bring up topics that people may be curious about, things that I see at my office. And if you have any questions or anything you'd like to learn more about, please mention them in the comments below. And by the way, hit the like button and subscribe to our channel, and we'll keep trying to bring you great content.